Everyone. Today I want to review our latest updates on hospitalization rates and ventilator data and what these numbers might mean in the larger context of our curve. But before we get into the data and the trends that we're seeing, I want everyone to understand something very important. Exactly 1 week ago, I stood in front of you to deliver the solemn news that we had reached a new record high single-day increase in COVID-related deaths in Illinois. We then proceeded to hit or surpass that marker twice on the days since. We then, today is not a record, but 74 more Illinoisans lost their lives since yesterday's update. To the loved ones of those individuals and all who we've lost in the fight against this virus, the entire state of Illinois grieves with you. As we work to defeat COVID-19, at some point we will have fewer cases to report and fewer lives lost. That will be good news. But it doesn't change the fact that each and every life that we lose to this virus is an immense tragedy. May each and every one of their memories be for a blessing. With that said, I want to start our conversation today with one of the numbers that we watch closely, and that's our doubling rate. That's the number of days that it takes to double case counts, hospitalizations, or deaths. Why is that important? Well, because the higher that number is, the slower your growth, which means the flatter your curve. At the beginning of this pandemic, our doubling rates were very low. And since we put all our executive orders in place, Illinois has seen our doubling rates increase substantially. That is a very good thing. On March 22nd, the rate at which our COVID positive case count was doubling was just about 2 days. By April 1st, that rate had increased to around 3.6 days. As of this Sunday, April 12th, our case doubling rate had reached 8.2 days. Similarly, our mortality doubling rate has increased. At the beginning of April, it was at 2.5 days, and it is now at 5.5 days. To be clear, there is nothing good about twice as many people having this virus, or worse, dying from it, no matter how long the increase takes. But we won't get to 0 cases overnight. The fact that our doubling rate continues to increase in every metric is a clear demonstration that there is a deceleration of virus transmission. We are, in fact, bending the curve. Perhaps the most accurate leading indicator of our progress is our hospitalization data. Right now, if someone is sick enough with a respiratory illness to need hospital care, then it's likely that that person has COVID-19, whether or not they have been tested. On April 6th, the number of known COVID patients and suspected COVID patients totaled 3,680. On April 10th, that number was 4,020. On April 11th, it was 4,104. On April 12th, 4,091. As of today, it was 4,283. As you can see, these numbers are increasing. However, so too is our overall hospital capacity. Our hospitals are working every day to add beds. In August of 2019, just to give you a number way before COVID-19 came to us, our state averaged about 25,500 total beds. As of this weekend, our total bed count is about 30,000. 2 other important metrics are ICU beds and ventilators. A week ago, COVID patients as a percentage of ICU beds increased from 35% to 43%, an 8 percentage point jump. COVID patients today occupy 40% of our total ICU beds. That's down from the 43% a week ago. In the same time frame, COVID patients as a percentage of total ventilators grew from 24 to 29%, a 5-point jump in a week. COVID patients today occupy 25% of our total ventilators. Both of those numbers are evidence of positive trends, a declining percentage of ICU beds occupied by COVID patients and a declining number of ventilators occupied by COVID patients. Additionally, our total ventilator numbers are starting to reflect the additional ventilators that we've acquired, now totaling more than 3,000 across the state. Overall, these numbers are indicators of our growing ability to manage capacity within the healthcare systems across Illinois. We track not only individual hospitals, but also by region. And we keep our eyes trained on the regions with capacity in any of these metrics that fall below a critical level. Though that's what we pay attention to at our daily meetings. Today, no region is currently below 15% availability in any of these metrics. But there are individual hospitals that are operating at or near max capacity. Right now, hospitals are by and large doing a great job of directing patients amongst themselves. But if it becomes necessary, I will not hesitate to step in to direct ICU patients to hospitals that are more available. And while we're talking about capacity, I am so deeply thankful for the now 3,600 retired and out-of-state healthcare professionals who have applied to join Illinois' fight against COVID-19. Before I turn it over to Dr. Ezike, I feel compelled to address what it will mean when we say we've flattened the curve. Folks, this curve may not flatten, and it may go up again if we don't adhere to the stay-at-home order. We need to stay the course for now for our efforts to truly remain effective. Let me lay it out more clearly. There is no one who wants our state to open up more than I do. I want kids to go back to school, and I want parents to go back to work. I want families to enjoy our parks and lakefronts. I want small businesses thriving, restaurants flooded with reservations, job growth to return to their record highs. But no matter what the president may say, I will do what's best to safeguard the health and safety of Illinois' residents. That means test, trace, and treat. I'm hopeful the president will help us accomplish that, because that's what will make it safer for people to begin to return to their normal lives. What we have to do is to design a new normal, a way of life to carry us to the other side. And while that day is not here yet, my team and I are working to bring that about, as are experts around the state and across the globe. No one looks forward to that day more than I do.